Thanks for staying with us. So before we close the show, it was important for us to have a conversation with Dr. Chinwe Ochu, who is the Prevention Program and Knowledge Management Department head, right there, to give us an update on the government's directives, especially now that COVID, the second wave, is upon us. Dr. Chinwe Ochu, are you there?
Yes, thank you very much for having me.
Yes, thank you for joining us. So very quickly, madam, could you just give us a summary of what the new directives are and how best we can begin to adhere to these new directives?
Okay, we want Nigerians to know that we are having an increasing number of cases of COVID-19 in the country. We had a respite, but the numbers have started rising. And this is mostly as a result of widespread lack of adherence to COVID-19 protocols. We are also at a point very close to a festivity, a very popular one that will mean a lot of people may have to travel. There will be a lot of social gatherings here and there. So our advice to Nigerians is if you don't have to travel, please don't travel. Let's avoid non-essential travels because the more we come in contact with people, who have large gatherings, people moving from one place to the other, the higher the risk of transmitting the virus. So if you don't have to travel, please don't travel. And if you must travel, make sure you adhere to these protocols. Keep a distance from the other person next to you of a minimum distance of about 1 meter, especially if you're wearing your face mask. Ensure you wear a face mask properly, covering your nose and your mouth as you leave your house. Maintain good hand and respiratory hygiene. Wash your hands frequently with soap under running water. As you travel and you get home, please try to celebrate among your own family members. This is not the time to really visit the neighbor, do this or that. And if you must do that, please make sure you wear your face mask and you keep that distance from the other person. That will make it difficult for whatever is coming from the respiratory tract of that person to get to you. Remember that in the villages where people are going to now, that's where we have most of the high-risk persons, like the elderly and those with comorbidities. So people that are asymptomatic, that travel home to the village to celebrate with their loved ones, have that tendency of being able to transmit the virus to those that are at high risk of having the severe forms or even dying from it. So we have to be very, very careful and ensure that as we are celebrating safely. So let's avoid gatherings. And if you must have meeting or the other, try to meet in open spaces where there is good ventilation.
Dr. Ochu,
make sure that you have fresh air.
Dr. Ochu, could you please confirm to us this new strain we're reading about? Is that true? Is there a new strain? And if there is, what are the characteristics of this new trait, and how do we prevent ourselves from catching it or contracting it?
Research has shown us that there are some emerging strains. In UK, it's been discovered in UK and the other countries. Even in Nigeria, we have demonstrated a very minimal number of that strain in the country, but a lot is still unknown about that strain. So a lot of scientific research is going on to understand whether that new strain poses any higher risk of transmission and whether it is associated with more severe forms of the disease. So there's still a lot that we don't know about that new strain, and that is why we are advising that we continue to try to protect ourselves from even getting the virus, whatever strain it is. All these social measures, public health and social measures, non-pharmaceutical interventions of physical distancing, proper hand hygiene, proper respiratory hygiene, avoiding large gatherings, maintaining that distance of about 2 meters, or where that is not possible, at least 1 meter from the other person, is still able to keep us from whatever strain of the virus is out there in the community.
Okay. Dr. Ochu, I have one more question for you. Is there a smooth communication between NCDC and other federal agencies? Because 1 second NIN telling us, NCC is telling us we have to go and get our NIN numbers before we shut down at the end of the year. And then we see this huge crowd. So you're telling us not to go out to and maintain social distancing, but are you telling your colleagues in the federal government the same thing? Because they make these announcements and I just troop out, and then it causes the spread of this virus.
Well, our message has been the same right from the beginning of this response, and we work very closely with other government agencies. What we launched against the COVID-19 was a multi-sectoral response. So, and the protocol is very clear. We don't encourage large gatherings of any form at this time, especially now that we are very close to a second wave. We've already started climbing the steepest slope of another wave. So where people must, meet in large numbers, so to say, then there must be things put in place to ensure that there's that distance between one person and the other. And also, we can stagger, that kind of registration can be staggered so that all the people don't have to come to that particular place at the same time. So there are ways we can get about this and still continue to run our society without exposing ourselves to unnecessary risk.
All right. Thank you very much, madam. We appreciate it. Sorry we had to bring you up very quickly, but it was important for us to get the facts from you to be sure what the next steps are. But thank you very much for clarifying that for us. Okay. We'll be speaking with the head of Prevention and Program and Knowledge Management at Department of NCDC, Dr. Chinwe Ochu. That's all we can take, ladies, on the show. Have a fabulous day. We'll see you tomorrow. Bye for now.